Hello, everybody, and welcome to Answers for June 2nd, 2020. I'm Kevin Daly. Today on Answers, there will be an update on the school situation. Audra Talbot will give us an update on school at home. My guest this week is Ravit Stein, who is Director of Psychological and Behavioral Consultation Services at EastCon. And as always, there will be time for Q&A with participants. So get ready to hit that Q&A button. If you have a question, send it to us. Don't wait till the end. We want to hear from you. Answers is brought to you by PATH, Parent to Parent Family Voices of Connecticut, a nonprofit organization which for over 30 years has served the needs of families that have children with special health care needs. Here in front of you, you see a partial list of PATH programs and services. I just wanted to let you know about a new webinar series from PATH, and it debuts tomorrow at 6 p.m. It's called A Guide to Supporting Youth Through Transition. And in this case, it's the transition young people make from high school to adult life. Here you see a picture of the person who's putting it on. Her name is Kathleen Tetrell. She is a disability planning attorney in Hartford. First up tomorrow night, the webinar will cover best practices for decision making and planning the future. On July 1st, people and families who are using these best practices will be interviewed. On July 29th, the webinar will deal with finances and how to handle them. And in August, there will be two webinars. The first will cover employment. The second will cover higher education. You need to register in advance for these webinars. And to register, send an email to PATH at info@pathct.org. If you'd like to know more about PATH, please visit our website. Website address is right in front of you. And if you'd like to know more about this webinar, or if you have any questions, please contact me directly, Kevin Daly, at the email address you see in front of you. While you're online, visit us on Facebook and like us. Also follow us on Twitter and watch us on YouTube, where we ask you to like and subscribe. And here's the fine print, folks. This webinar is not legal advice. It should not be taken as healthcare advice. It should not be taken as advice at all. It is a webinar about looking for answers at a time where all of us have more questions than answers. This webinar and any attached materials are the sole property of PATH and are not to be used for any other purpose without the express written permission of PATH. Here's the school update for June 2nd. Schools across the country continue to be closed for the rest of the school year, except in the states of Montana and Wyoming. In these states, the decision to reopen is left up to individual school districts, and since May, a small number of school districts in these two states have opened and continued operation. Meanwhile, in Connecticut, schools continue to be closed for the rest of the academic year, and that academic year ends no later than June 30th. PPT meetings, 504 meetings, they're going on right now on an as-needed basis. Unfinished evaluations are on hold until the schools reopen and they can be finished. On the other hand, if an evaluation was finished and ready to go before the schools closed, it is possible to PPT and consider that evaluation if school and home agree to it. And as it often happens at this time of year, all eyes are on summer and the next school year. During this summer, some special education students will experience ESY, Extended School Year, which is a summer program for special ed students who are eligible. The eligibility is determined by their PPT team, the State Department of Education has directed public schools to provide ESY to eligible students to the greatest extent possible. And by the way, the eligibility requirements for ESY have not changed. Some students will go to summer school this summer. I mean the regular summer school program that school districts offer for all their students. These programs are allowed to open in person with many, many restrictions on July 6th. And the State Department of Education is going to issue guidance on exactly what should happen in these summer school programs sometime before July 6th. Some young people this summer will go to day camp. Unfortunately, overnight camps are not happening this year, but day camps are. They're allowed to open on June 22nd, although if a camp was open on May 5th, it's allowed to stay open. And guidance on how to operate the day camps is going to come from the Commissioner of Early Childhood, and that guidance is forthcoming. What kind of things could affect extended school year or summer school or summer camp? The kind of things that have been affecting us all along, they are state and local public health restrictions, the availability of personal protective equipment for teachers and staff, and even guidance from other state agencies. All these can affect the ability of a school district to provide ESY or summer school or for a summer camp. So all these variables, they could have some effect, and sooner or later, I'm sure they will. An ongoing problem, especially in Connecticut cities, has been ghost students. This is something large cities in Connecticut are experiencing, and I'm sure it's prevalent in other states too. These are students who seem to have disappeared off the face of the earth when the schools closed in March, and the schools are not hearing from them. What's going on in Hartford is a good example. As reported by the Hartford Courant on Sunday, on the average, 20% of Hartford students are not participating in distance learning, either the high-tech version or the low-tech version. Most of these students are in communication with the school. They just haven't been turning in any assignments. And some families are nearly impossible to reach for whatever reasons. In the 1 week period from May 11th to May 15th, 1 week of school, more than 700 Hartford students had no communication with their schools. And out of that 700, 424 of them, they just don't know how to classify them. Have they moved out of the district? Are they AWOL? It's a big question mark. The superintendent of the Hartford schools, Leslie Torres Rodriguez, she put it very succinctly. Where are they? We can't find them. It is a problem. It's a problem because these ghost students, they're missing a large chunk of their education. And bringing them back to speed when schools reopen, that's going to be a challenge. And their loss of education will only tend to widen the division that exists between students in the large cities and students in more affluent communities. That's undoubtedly going to happen. Changing gears, let's talk about next year. And a lot of people are wondering, what will happen when schools reopen? Now, you can be sure Connecticut state agencies and federal agencies will issue guidance for the schools on how to reopen. But without that guidance, it's difficult to say exactly what will happen in our state, what will happen in your own school. But we can get a rough idea of what's going to happen by looking at guidance that was issued by the CDC, the Centers for Disease Control and Prevention, guidance that was issued in May. The CDC is recommending that in schools, everyone wears masks, students, teachers, staff, everyone. Schools should increase ventilation with outside air as opposed to recirculating used air. The CDC recommends keeping students in small groups as opposed to large assemblies and keeping them together throughout the day to minimize social contact. In the classroom, the CDC recommends turning desks to face all the same direction and keeping them 6 feet apart if possible. In the classroom, the CDC recommends providing high-touch objects like art supplies, electronics, rulers, protractors, pencils, that kind of thing, so students don't have to share them. Provide enough so each student can have their own. CDC recommends that common areas, including cafeterias, should be closed. It's hard to picture a public school without a cafeteria, isn't it? It doesn't mean the cafeteria can't produce food, but the idea of all the students going to the cafeteria for lunch, that's an idea that now it's kind of dated. Students are to eat in their classrooms, according to the CDC, and that will minimize social contact and the possibility of the virus spreading. CDC also recommends daily health checks of staff and students to isolate individuals that are showing signs of being sick. And for the people who are at higher risk for severe illness, whether it's staff or students, the CDC advises providing options for distance learning or telework so that no one has to be at risk, to minimize that risk. And if someone in a school is identified as having the virus, CDC recommends closing the school for a day or two and doing a thorough cleaning, sanitizing job. Now, many of these suggestions from the CDC are already in use in other parts of the world and here in the US where schools have opened up. Here you see a picture of students in Vietnam. All the students are wearing masks in class. Here's a classroom in China where all the students are wearing masks. At this high school in China, the hallway is partitioned into 2 one-way lanes. The students walk single file, all this done to minimize social interaction and keep that social distancing going. At this school in Germany, you'll see all the desks are facing the same direction, and they look like they're at least 6 feet apart. At this school in China, before entering the school, the students are checked, their temperatures are checked to see if they might be infected. Of course, this is happening here in the US too, at Willow Creek Public School in Montana. In this picture, you see the school principal as she checks the temperature of students entering the building. At Willow Creek Public School, the students wear masks going to school, while in school, and when leaving school. And the teachers use 6-foot pool noodles to enforce the 6-foot social distancing. And of course, everywhere, cleaning, disinfecting, that's going to be a large part of public education, even larger than it was before. There are still many unanswered questions about school next year. What's it going to be like? How will the schools be organized? It's going to be a big job for the schools because our schools were not built for educating students in small groups. Our schools were built for educating students in large groups. So there are many changes coming up. There's going to be lots of guidance coming from state agencies. And right now we just have lots of questions swirling around. Sooner or later, there will be answers. And I guarantee you, when you come here, you will find those answers. On the next edition of Answers on June 9th, my guest will be Sarah Moon, Director of Special Services at Learn. Coming up, Dr. Ravit Stein from EastCon. But first, Audra Talbot with the School at Home update. Earlier, Audra spoke with speech-language pathologist Marcy Silver. Let's listen in on their conversation.
My name is Audra Talbot, and I'd like to welcome tonight Marcy Silver, who is a speech and language pathologist. In my opinion, probably one of the best ones I've ever seen. So Marcy joins us tonight, and she's going to discuss telehealth and speech and language pathology and how that's delivered over the computer to our children. Hi, Marcy. Thanks for joining us.
Thank you for having me.
So, Marcy, could you give us a quick introduction about your background, maybe why you became a speech and language pathologist, and how you've kind of evolved into where you are now delivering services through telehealth?
Sure. So my name is Marcy Silver, and I've been practicing speech-language pathology since around 2001 when I graduated from Columbia University Teachers College with a master's in speech-language pathology, and I did an undergrad at Syracuse University for communication sciences and disorders. I've had a lot of experience in the Connecticut school system, actually. When I graduated, I moved back to Connecticut to save money and work at Wheeler Clinic with socially emotionally disturbed population, and where I did my clinical fellowship. And then I worked in the public schools at Plymouth Center School in Terryville, Plymouth. And then after that, I knew I wanted to go back to New York City, where I worked in the hospitals with both adults and children in an outpatient setting, which just led me to having close connections with pediatricians, with ear, nose, and throat doctors. And I did some early intervention in New York City. So I've been in pretty much every system. And then that's when I decided to go into private practice and sort of just be a generalist in my therapy, in my evaluation, and just dive into public schools, private education, private special education, private regular education, just to know every avenue possible for the children who have special needs. So anyway, when this whole pandemic happened, I, of course, thought, okay, how am I going to make this happen? My practice in New York City, I travel to people's apartments. I take the subway there. I take the bus. I take Ubers. I have to figure this out. So I just jumped right in. And actually, I had interviewed to do online services through telehealth before this all happened because I wanted to learn about it. I wanted to see what's this new rage of telehealth. I got the position and I decided to wait until the summer to take a couple cases to learn how to do telehealth online. And interesting enough, I'm a communication specialist. So I thought, I'm not sure kids are going to get the best possible service online. How is that going to work? Well, one thing led to another, and I had to learn myself quickly on how to do this. And I am having so much success with my kids from all ages. I'm getting a lot of trials that I didn't get before. I'm getting a lot of language that I might not get in person, depending on the child. So that's where I'm at now. It's a huge learning curve. I'm still learning every day with every kid, with every child. But I feel that I actually sometimes can be more effective online with some of these children because computer technology has allowed these children who really struggle with receptive and expressive communication to actually feel more comfortable online.
So in your private practice as a SLP, what kind of therapeutic services do you provide to school-age children? Now, you mentioned that you work the one-to-one with receptive expressive, but what other things do you offer, such as social skills or anything like that?
Yeah, so I see a variety of communication delays and disorders. I work with stuttering. I work with children with autism. I work with cleft palate, any child born with a syndrome. And I actually am working on some social groups. And I also, from a social standpoint, I try to be that, whatever age they are, I try to be that. If I don't have that availability for a child, a parent might not be interested in the therapy, I need to be that child and pretend to act the age of that child and give them that social, those social skills groups. So, I am constantly learning what these children are into. If the child loves space, I'm learning space games. If the child is into cooking, I have to know every cooking app out there. I need to know, I have a child that loves Star Wars and space, learning all that's out there. And what's the rage? What are kids loving to talk about? Superheroes. Trolls is the new movie. I have to know all the trolls names, talk about the figurines that I have at home, so I'm actually like reliving childhood to get these kids to have those social groups. So if I don't have access to another child because of timing and these kids are booked with online school or not, or the parents decided not to do it and they're doing, hiking and whatever they decide to do, I still have to be that child's peer. So that's how I handle it if it's not accessible.
When you provide therapy for a child who has an IEP with goals and objectives in the area of speech and language, do you usually collaborate with the school's SLP?
Yes, absolutely. So I believe in, transdisciplinary, multidisciplinary approach. I am contacting the pediatrician. I'm contacting the teacher. I'm contacting the PT, the OT, whatever the child's life is, parents, caregiver. They need to be aware of all the goals. They need strategies. It's really, really important. And that's where I see the most success and the most progress is when everybody is working together, or somebody says that's not working for me. What else can I do? So I'm a huge, advocate for multidisciplinary team.
I agree.
Yeah.
I agree. I think it's a team approach for everything, because if you can't have that, it's just not going to work.
Yeah. And, sometimes I'm hired to work on a certain something like feeding. I do the feeding, the speech therapist in school does the speech and language, or I do the speech and language and she's doing play or the social groups. And we're able to coordinate that way. Or we're working on the same goals. Sometimes it's better if we both target the same thing. So it depends on the child. It depends on what the parents' hopes and dreams and challenges are. I always say, what would you like your child? What would, out of everything, what would you love your child to do? What would make you happy right now, just now, today? Or, so I'm very much about the parents, what their struggles are at home, or what they see at school that they'd want the child to do.
So what about summer? So there's some programs that will be open, some programs will be closed. I think a lot of it is pending on what comes down from the public health department regarding COVID. But as far as our kids that are home, what are some tips or hints you could give to families? Should they still be engaging in teletherapy with a therapist? Do you think that they should take a break? What do you think about summer?
I think you should keep it as you usually do. So if you give the child a break over the summer and they don't have services, then you have fun. You do camp-like activities and you just enjoy. But if you find that the child is, doing well with telehealth and likes the therapy. I'm planning on seeing whoever wants therapy. I work through the summer, I work all the time. Whatever I can do, especially if there's going to be nothing happening. If no services, in person are available, I'm certainly available. And I think that, I think because these children are not getting human connection, that any connection with their therapists and their teachers is super, super important, just to keep that that memory alive, that motor memory, that emotional memory, very important. Even just if you decrease it, maybe, if it's a 5-day-a-week therapy and you decrease it to 2 or 3 just to give them a break, fine. But I'm seeing, even for myself as a therapist, it makes me I miss the kids. So when I see that child and they're just so excited to see me, that's connection. So more than anything, who cares about the goals? We want to care about the goals, but more than anything, it's the connection that they have with that person, that adult, or the kid.
It's true. But we as humans, that's what we crave. We crave connections. And if we can give that to our kids over the summer, then it's a win. At least in this house it is.
Yeah. And I feel like, we have to think back to our favorite teachers, when we were kids, and how excited it was to see them at the supermarket in the summer, or seeing them at a game that we were at. It's just that, kids love and admire the teachers that are helping them through hard times. So if they don't see these people at all in the summer, it's a disconnect that they really need right now.
So, I like that.
Yeah.
That's really good. At some point in the future, after things return to normal, we will look back at the pandemic and perhaps we will see that we discovered some new tools to help children with speech and language difficulties. Distance learning, telehealth for therapy. Do you see any improvements coming out of this terrible crisis?
Yeah, I do. I definitely think that this pause, I'm thinking of it as a pause, will make us reevaluate the chaos that we create for ourselves in life. I live in New York City. New York City is a very different place right now. And in some ways, it's saying goodbye to a city that was really hustling and bustling. Maybe it won't be back to where it was before, but it's a newness. It's something new. They keep saying the new normal. And I think that, what I see with some of the children that do have special needs, that have a really packed therapy schedule, and they're very, very scheduled, that and with all kids these days, we really schedule them. We schedule them because we want to keep them busy because we're busy. That it'll just balance them, I think, a little bit more when they have that freedom to just sit with themselves, and, for a child that has sensory stimulation needs and they need to stim, whatever, they need that break, that stimulation break, let them do that a little bit. They need that because it makes them feel good. As adults, we want to feel good. What do? We go for a pedicure, a manicure. We can't have that right now. We would if we could, right? Or, a massage or a walk. So we have to think about them too and what they need, because we're just, I see a lot of kids back to back. They get PT, they get OT, they get speech back to back to back. And that might not be the answer either necessarily. But now it gives us that chance to say, okay, they have that downtime too. is it better? Are they doing better, or are they regressing? And it kind of gives us, it makes us understand our children better, I think.
Do you have anything in closing you'd like to say?
I mean, I just want to say that, parents are the superheroes right now. The healthcare workers are the superheroes right now. And parents need to reach out more than ever to their providers with whatever we can help with. Even if it's just for us to lend an ear and listen. We might not even have the answer, nor do you want to hear the answer. I think it's just, you need to vent. You have a lot of pressures. And being with your family, your spouse, whoever's in your home all at once, not being able to leave, it's stressful. So I think I'm about staying in the day, keeping it as simple as possible, and let go of the battle. Like, if you're battling with something, it's just better to let it go. Pick your battles. It's that simple, pick your battles, and keep it simple right now. So thank you so much for having me.
I love it. I love your insight. It's refreshing. So thank you. So thank you for joining us tonight. This is PATH, Parent to Parent, Filling Voices of Connecticut. And this was Marcy Silver. And thank you, Marcy. It was a pleasure having you on the show tonight. This is Audrey Talbot, and we'll see you next week. Thank you. Good night. Hi, Kevin. Good evening, everyone.
So Marcy seems to be very accomplished with telehealth, teletherapy. Did you get that impression too?
Yeah, absolutely. And I have to tell you, that's why I invited her to do the interview, because I knew Marcy was already looking at that even before COVID happened. So she was kind of ahead of the curve, if you will. And on top of that, she's just so, she's a young go-getter, dynamic woman. And she's built this this speech, world. Her world is speech and language pathology. And I think that she just does it so well. And her it's almost like this intuition she has to help parents through this. And it's a very selfless thing. So I think all around, she's just a great therapist. She knows the technology, which is very important in a therapist, but she's so creative.
Yeah. Well, that's an important aspect of her job. I was wondering, do you have any personal experience, firsthand experience with telehealth or teletherapy?
I do, actually. And it only happened after the COVID crisis. My children, obviously, we do distance learning. And so we access related services through distance learning, through the schools that they go to. But we also access telehealth for medical and for our outside therapy appointments. And what I find the most interesting thing is that I have more, I guess it would be more one-to-one time with our service providers, if you will, because it's almost like, so when my child is in the therapy session with the provider, they're on a one-to-one thing. But then afterwards, I get my 10 minutes afterwards, and I get to kind of hot wash everything and talk about what's going on in the house, how we can improve that. So it's a really huge collaboration. And I think it takes practice in order to do that, because I was not that great at it at first. I was very overwhelmed by it. But then I kind of fell into the stride of it. And I have to tell you, I kind of like it. It's nice that I don't have to get in the car and drive, an hour to a doctor appointment. I can just do it and have it be almost as good or better of an experience. So, and I know insurance is a factor for some of the medical appointments, but I think if you can weed through that and get that approved, I think it's worth a try. Absolutely. I'd recommend doing it if you're not doing it already.
Excellent. Excellent. Food for thought for anyone who wants to try it. I have a feeling it may be something like, cell phones were I remember when cell phones first came out, there were people who vowed that they would never use them. And through attrition, we now have everyone using cell phones. So it could be that this is an idea that we'll see more and more of in the future. Audra, thank you so much. And I'm looking forward to your segment next week.
Me too. Good night, everyone.
All right. And now, Dr. Ravit Stein from EastCon.
Good evening.
Hi, Ravit. How are you?
Great. Thanks for having me.
Welcome to Answers.
Thank you.
Thank you so much for joining me. Now, I understand you're with EastCon. What is EastCon?
EastCon is a regional education service center. We're based in the northeast corner of Connecticut, and we're one of 6 regional education centers that support public school districts across the state in addressing a variety of needs for children from birth all the way through adulthood. My job at EastCon is to direct the Psychological and Behavioral Consultation Division. I oversee a group of psychologists, BCBAs, who are board certified behavior analysts, special education teachers, among other specialists from a variety of related service groups, to consult with teachers and administrators from districts all over Connecticut and sometimes even outside our state around a variety of supports for students with special needs, students with disabilities, as well as all students across general education. I'm excited to join you guys tonight.
Well, excellent. And it isn't very often that I have someone on the webinar as a guest who is so highly trained as you are. Let's see now, you are a psychologist, you are a board certified behavior analyst, and you are a certified school psychologist.
Yes.
I would think that would make you an expert on a lot of things, including behavior. Am I right about that?
I don't like to call myself an expert. I'm always learning, but I do spend a lot of my days working with many stakeholders, parents, and schools around addressing behaviors.
Sure. Well, behavior is something that parents who are supervising their children's distance learning, parents are getting to see up close the behaviors that they sometimes don't see, but are shown in school all the time. What do you think parents of special education students could do at home while schools are closed to help their child maintain progress with their behavior goals and objectives in their IEP?
Well, I guess first and foremost, I come from the approach that behavior is communication. So behavior is just a form of communication, and we as adults all use our behaviors to communicate our wants and needs. And when children and students, whether they're at home or in school, are behaving in certain ways, they're communicating with us. So I think if we can first and foremost consider what they're trying to tell us with their behavior, that's the starting point. And I think that's another more simple way, if families have heard of the idea of function of behavior. What that really is just, what are they trying to tell us with their behavior? Are they trying to tell us that they want to get something or to get out of something, or they want more attention or support, or they want a break or to be left alone? So function of behavior is really, what are children communicating with their behavior? So it's a big question to ask in terms of what parents can do. But I think first and foremost, the conversation would be, what is my child trying to tell me with their behavior?
That's a good point. that is a good point. And so often the meaning behind the behavior, it's elusive. Figuring it out is the key to a lot of things. So let's talk about evaluations for a second. By the time the schools reopen, special educators will be faced with a mountain of missed evaluations. Everything from the middle of March up to when the schools reopen. And then there are the ongoing evaluations that are already scheduled for that. We're talking about a real mountain of missed evaluations. How are schools going to handle it? What do you think?
Well, that is definitely the $100,000 or $1 million question. I think that identifying priorities in evaluations will be one of the keys. I think identifying priorities for everything will be really important in supporting our students when they come back. There's only going to be so many minutes in the school day. And that might even be reduced in the fall, if at all. And we'll really need to think about what is the most important thing that we need to know that we don't already know that will help us support students in making gains or understanding where they need to go next. And we do know that there will be regressions. The literature is telling us that students will regress in different areas, some more than others. But we really need to understand, what do we care most about first in terms of closing those gaps and using that those priorities to guide our evaluations. I also really want to highlight the importance of recognizing that the people that are going to be doing those evaluations are also often the people who are the front line of intervention. So if we're talking about a school psychologist, which is my background, or a speech pathologist, or a special education teacher, if those people are tied up in evaluations, they also can't be providing the intensive interventions that we'll need to close those gaps. And so thinking about what's, again, the best use of time and finding the balance between what do we really need to know and what do we want to jump in on in terms of providing intensive intervention without getting bogged down in the evaluation. So I think it's going to be a long process in figuring that out. But for parents out there, I think spending time thinking about your child's IEP and thinking about, if you had to choose the goals and objectives that would be most important for you to really have your child's school focus on when you return, that sharing that and advocating for the evaluation in those areas versus a general all-inclusive evaluation of everything that might impact the amount of time your child actually has to engage in intervention.
As it is so often in life, it seems time is the enemy. The time limitations, and there isn't unlimited time. There's only so many hours in the school day. And then, of course, students learn at their own rate. You can't double the amount of progress a child makes simply by doubling the amount of service time they get. Unfortunately, it's not that simple.
Yeah, it's an analogy that I often use and is somewhat relevant now as some of us who have been more sedentary at home these days and are creeping up towards what some people are calling the quarantine 15 or the COVID-19 in terms of buttoning our own pants. If we haven't been to the gym in a while and we need to go back to the gym and we decide, all of my muscles are out of shape, so I'm going to go back to the gym and spend 1 minute on each piece of equipment for the next 45 minutes, I'm not sure that I'll be able to actually get back in shape because I'm going to try to spend such a little amount of time on so many different areas versus saying, you know what, the most important thing for me right now is to get my heart rate back to where I want it to be when I'm running. So I'm going to spend 30 minutes of that on a treadmill and 15 minutes stretching and really recognizing that might not get me exactly where I was, but it's going to address the things that I care about the most right now. So I sometimes think about IEPs in that way because the more objective, sometimes the harder it is to really dig into what we care about the most.
Understandable. Sure. Now let's talk about regression a little bit more, because it's assumed that some of the kids will regress during distance learning. Although I have to say, I've heard reports from parents who have told me their children take really well to distance learning. And in a couple of cases where the difficulty in school came from social factors rather than academic challenges. Academically, their children are doing really well, especially one youngster who his difficulty was work avoidance. Now at home, with his mother supervising his distance learning and work completion, that's not an issue anymore. So some kids take to it very well. Other kids, it's less effective. It's certainly not ideal. So there will be some kids who have regressed. Schools will want to catch them up. And I'm thinking of the area of behavior now. When it comes to math, it's pretty easy to get a measure of where a child stands in math. When it comes to behavior, it's a lot more complicated. So when a child has regressed and their team has decided they do need some kind of restorative service in addition to what they were already getting, it comes down to assessing how much they need. How could that be done? Is FBA, a functional behavioral analysis, the way to go? Or is there a more efficient way to do it? What do you think?
So you had a few different points in your question that I wanted to touch on. One is that some students are doing better during COVID. And I think as I'm an optimist at heart, and there are a lot of silver linings in this distance learning framework, both among students and teachers who have become so much more creative with technology, or had to become creative with technology in order to engage students. And I do think that we'll be coming back to a world where we will hopefully be able to take the strengths and what we learned about what worked for students via distance learning and try to implement those when we come back to school so that we can maximize the strengths. I know that when I conduct FBAs, one of the most important questions I ask is, where is the child doing well? What is going well for this child who's just been referred for an FBA? Because I want to see when that child is doing well and what it looks like in that classroom. And I think that that's something that's important to think about when the kids come back, because even if they have more behaviors or more struggles, there are going to be times and situations where those students are doing better, and capitalizing on those situations is going to be critical in supporting improved outcomes. In terms of understanding behavior, first, I do want to say that I think all of our students, not just our students with disabilities, but all of our students when they come back are going to need so much more from a mental health and trauma sensitive lens. And so some of the practices that are tried and true and best practices in really building strong relationships with students and improving behavior in schools really should be applied to all students when we come back. And I know that schools right now are really working towards building more rigorous and comprehensive universal supports for behavior, because even students who may have not exhibited maladaptive behaviors prior to school closures will potentially come back with some challenges as well. So I think one of the things that schools can and will be will be helpful for them to do is to consider the universal behavioral supports that will be helpful. That being said, for students who potentially have behavior goals in their IEP and we don't know what things look like when they come back, an FBA isn't the the hammer that we need to necessarily use for everything. I do obviously subscribe to the importance of recognizing and understanding function. And I do think there's a time and place for FBAs. But I think that when we understand that a student has certain maladaptive behaviors and they occur at a certain rate, understanding present levels of that child's performance in the area of behavior, just like we will in the area of math and reading, will be really the first step in understanding how we need to address the problem, because the intensity of the problem will guide the intensity of the intervention, just like it will in reading and math. And so getting that baseline, getting that present level of performance will really be the first step. And for many of these students, a lot of things that we were doing were working for them before we left. And so before jumping into more evaluation, I'm always a proponent of saying, let's make sure that what we did before we do with fidelity and assess how well that works before we try something new. Again, the adult example for that is during COVID, I subscribed to one of those, Beachbody on demand things that would have lots of results that people have said go very well. But if you don't turn on the TV and do the workout ever, it doesn't really matter if PX90 had really good results for a lot of people. And so for me, the fidelity of implementation of that intervention was abysmal over COVID thus far. But that being said, I think that when we think about students and interventions, we really want to make sure that we do the intervention and do it well before we say, well, let's throw everything out and start a new FBA.
I like that approach. It should work in education. I can see how it would work in life too. So that's some good advice there. So I'm going to ask you for a second to take out a crystal ball and look into the future. And I'm thinking of next year after school reopens and related service providers, not just in the area of behavior, but other disciplines, OTs, PTs, SLPs, the whole alphabet soup. These folks work with our children, sometimes one-on-one, sometimes in a small group. If service providers have to maintain distance from students, isn't that going to present some challenges?
Another $1 million question. Yes, I think that one of the biggest challenges that we are faced with is the safety of staff and students who need to interact, particularly among our populations that don't necessarily have functioning to be able to understand social distancing. I think that's going to impact our ability to do good evaluations. I think that if I tend to say that no data is better than bad data. And so I would err on the side of caution of trying to conduct evaluations that stray far from the standardization that's been developed for those evaluations. And in terms of the types of supports that are provided to students, I think we do need to utilize some of what we've learned in distance learning to think about how to be creative about services, even when we are back in school. Understanding risk and the different areas of risk, I know has been something that a lot of school nurses have been involved in conversations and a variety of multidisciplinary stakeholders. And I honestly think that people are still trying to figure out how to mediate risk, both for staff and students for our special populations.
I agree with you. There's still a lot to be figured out in that area. Fortunately, in the field of education, you have many people who are very creative, innovative. I think that this is a problem once thrown towards them, it will be taken care of one way or the other. So another question about behavior. I hear from parents of special education students that their children can't engage in distance learning, or they won't engage in it due to behavior or just a refusal. For many of these children, behavior difficulties are part of what makes them eligible for special education. What would you say to a parent who has a child who won't engage or doesn't engage in distance learning? What can a parent like that do to keep learning going while the schools are closed?
Again, a tricky question. And without knowing the specific situation for each family, I don't want to, provide overarching recommendations. That being said, there are a lot of tools that have been put out there for families to think about building routines and how those routines can help support. We know that students, all children, actually all humans, thrive on structure and predictability. And structure and predictability is one of the hardest things about COVID and school closure is the change in the amount of structure or lack of structure and predictability in our day-to-day. And so first and foremost, I think finding ways for families to build in some structure and predictability and routine in their day is potentially even more important than necessarily what getting on that computer, because I think that's the starting place for that. I also, again, I translate a lot of what I think about we should be doing now to what I think best practices are when we are in school. And one of the things that when we consult to our stakeholders in district, we're always talking about how can we maximize student voice and choice. So student ability to be able to choose and have some involvement in mastery over their circumstances can be a starting point. So the more choices the child can have in how they want to learn and how much they want to learn and what it looks like, because if a child is doing nothing, then 5 minutes is better than nothing. So starting to build in that gray of like, you only have to just log on, like working with teachers to say, we don't expect you to actually complete anything right now. If you haven't logged on in a week, let's make a goal that you'll just log on. You don't actually have to complete any work. You will just log on and join your class in their classroom meeting one time, and that will result in some sort of compliance, completion, positive grade, positive reward, or acknowledgement from family or from teacher. And what we call the continuum of engagement. If a child is not logging on at all, we have to break down that bridge to completing all assignments. And there's got to be steps along the way. And so the conversation becomes families, and if the family is already involved in trying to get their child to log on and they won't, working with the teacher and with the team around what's the first step on that bridge and how can we all build approximations. Again, I'll use an adult example. If somebody wants to learn to run a marathon, they're not going to go out and run 10 miles the first day. They might just go and walk a mile. And so we have to think about, what does walking a mile look like if the goal is the marathon for that child, and kind of reassess our expectations and then build reinforcement and feedback at those approximations of that. It's a hard question to answer. I understand that students with disabilities that have emotional and behavioral challenges also have a variety of other activities and things that may be things they have access to throughout the day that are more fun than school. So some of the work is around thinking about how to make that access contingent upon some sort of engagement, but I know that that's easier said than done.
Certainly. But I understand the approach and I like it. You start small. And then when there's a success, you build on that success. If necessary, baby steps all the way until you're ready to walk and then run that mile.
Mm-hmm.
Excellent. I have a question that is going to really assess your opinion of distance learning. Because someday the pandemic will pass. And at that point, we'll look back, with 2020 vision like we always do in the future. With 2020 hindsight, and we may see that we learned some lessons along the way in this great tragedy that we're experiencing through the entire world. In many ways, distance learning has evolved. It's evolved from being a hastily improvised stopgap, and it's going to become a more refined tool. School people are getting better at it. The students are getting better at it, and so are the parents. What do you think? Is there a future for distance learning? Does it have the potential to be an effective tool for some students?
I absolutely think there are many, many strengths to what we've learned from distance learning. I mean, you started by saying that there are some families that are saying that their students are doing better during this framework. We absolutely need to capitalize on those strengths and look at what's going well and what children gain from distance learning that wasn't present in our education framework prior, and make sure to integrate those variables that have met with success. I know that I also, in addition to overseeing a consultation division, I administrate a program for students with autism in Columbia, and it's called the EastCon Autism Program, and it's for students with significant disabilities who have been outplaced from their districts due to intense behavioral and or communication needs, and are often on the spectrum or have other neurodevelopmental disabilities. And so the teachers in the program that I oversee also, like you said, hastily began this distance learning framework on March 13th and have since really found some exciting ways in which students have responded. And one example would be that for students on the spectrum, we know that their ability to generalize skills from one setting to another is an area that we work on all the time, and the ability to apply their knowledge or something they've learned across settings, it's called generalization, is something that is a struggle for a lot of students on the autism spectrum disorder. And one of the things that we've learned is that they are having opportunities now through our work with families to actually practice those skills at home. We've also, and so we've seen where all of the work that we've done may fall down at home, and been able to kind of think through and problem solve with families how to maximize those opportunities for generalization, and really think about how to integrate that more consistently into the anchor of the way we approach programming, because what good is a skill if it can't be generalized to the child's home and community? I think another area is that we've figured out how to use our technology. For those familiar with the idea of doing trials or discrete trials, DTI as it's often called, we do that in a cubby space with the child, and we're needing to do that over the computer. And so we've found ways to use tools like PowerPoint that allow different things to pop up and enter and exit, and how those animations can fade over time to help the student become even more independent. We know that some students are really dependent on prompts, and sometimes in the day-to-day environment, we can maintain that prompt dependency and undermine opportunities for students to become even more independent, which is our ultimate goal. And so we've been using unique and creative frameworks through our technology to, for example, have something that's on the screen fade slowly over 10 seconds so that the student can learn the letter or number, and the prompt fades over time using the technology in Microsoft PowerPoint. And then over time, we can change the data so that the prompt fades in 7 seconds or 5 seconds or 3 seconds. And we've been able to make some really nice gains with student independence by using technology to help us fade prompts in a way that allows us to let the student shine through and learn and show us what they need to do before we sort of jump to help, if that makes sense.
Yes, it does. So I like the idea that this technology is going to continue to evolve. And well, I remember growing up as a kid, predictions about the future, about how we'd all be communicating like this. I think it's something that is close to being perfected. I'm still waiting for my jetpack, though. Don't have it yet. So let's see about questions, Q&A, and here's a question. Now it's a very simple question. It's about FBAs, but considering that next year when school reopens, it's going to be a very different landscape. The question is, what is the best time in the school year to conduct an FBA? What do you think, considering how next year is going to be?
I think that, is that coming from one of our participants or from you?
It's from a participant.
Okay. I think that whether or not we're in COVID, the idea around conducting an FBA really needs to come down to a few variables in terms of understanding the behavior and what we're going to learn from the FBA. So I really do think it's important to consider the frequency of the behavior that we want to change. If the behavior is not occurring frequently enough that we'll be able to get a decent data source on its frequency, then that will impact whether the FBA is a meaningful use of time. If the behavior, for example, isn't something that we can feasibly look at when we return because it's something that we would see later on. So I don't know if it's as much about the time of year as the behavior that we want to look at and change, and whether it will occur in a manner that will allow us to observe it and measure it. Because the basis of an FBA is the ability to observe and measure a behavior of concern in order to consider its function and the interventions that might help us. I do think that, given what I said earlier about priorities, that it may be even more important to use what I would consider function-based problem solving, function-based thinking, to assess whether interventions that have been successful in the past would continue to be successful if we tried them, and then use our time to take data on the effectiveness of the intervention rather than just the frequency of the behavior. And then we can also measure what the adults are doing when they're implementing an intervention, not just what the student's behavior looks like. So it's a question that is answered by many other questions, unfortunately, because it depends on what else is going on. I think if a family is in a situation where they requested an FBA prior to school closure and will be obtaining it when children return, I think the most important thing is to be really clear about the most important behavior of concern that can be expected to, that if we change that behavior, that would be the biggest bang for our buck, and start from there. And then we can decide, based on that behavior of concern, when is it going to be most helpful to look at it.
Okay, fair enough. Good advice from an experienced behaviorist. I want to thank you. And that is it for questions, and that's good because we are just about out of time. Ravit Stein, I want to thank you for joining me on this webinar. It's been really great having you.
Thanks. I did want to mention just one other resource that I had been thinking about whether I would share tonight. We developed, when schools quickly closed, we realized that there was two things. One, an opportunity to offer some additional training to paraeducators who are on the front lines, and I have so much respect for paraeducators, and they often don't have the opportunity to have as much training as they could and should to support students with really intensive needs. So we thought about the fact that during school closure, we could take the opportunity to support those paraeducators through a free series of trainings that our team built over the past few months. So I'm mentioning that because I was thinking about the degree to which, while I am not saying that the trainings are meant for parents, they were created and delivered with paraeducators in mind. In thinking back on the content, there are a variety of things that could potentially be helpful to parents to think about. The trainings were also not built for distance learning, but they are about things like building positive relationships with students, thinking about how to keep calm and correct errors in a way that supports reduction in those kinds of behaviors in the future, how to use visual supports to improve independence, among a variety of other topics. So I just wanted to say that if families are looking for some additional resources, and I know there's so many different things out there to read, but webinars are sort of a different medium, something to watch, and families could potentially take a look at those webinars. They're all pre-recorded and they're all free and available on our website just by going to www.eastcon.org. When you go right to that website, they'll pop up in a pop-up window right away, or you can look for them by going to our website. And therefore, they could potentially get some additional ideas about working with students at home during this time.
I like that. What was that website address again, please?
I'm actually just going to share the screen real quick so people can see it and know what it looks like when they come up about it. It's called Supporting Special Populations. It's actually a Google site, but the easiest way to get to it is by going to www.eastcon.org. And I'll show you that when you do that, right here, it says Free Paraeducators Virtual Training Series. Comes right up, and that brings you right to that site. And if you go to that site, the different webinars that are available are all noted here. Function-based thinking to improve student outcome. Every kid needs a champion. Overview of autism spectrum disorders. This is the one I was actually thinking of that could be helpful for families joining us tonight. It's called Keep Calm and Corrective Strategies for Responding to Challenging Behaviors. It isn't meant for COVID, but it's really about what do we do when kids are pushing our buttons, and a lot of the strategies are relevant every day. And I use them with my own children. Just scrolling through so you can see what the different websites are. The way to look at them is just by joining. You click any of these and you can just watch the recorded session. And there's worksheets that go along with them if people would like. They're all free. Again, I want to make the caveat that they were built for paraeducators, but I do think that some of the content could be helpful for parents.
Oh, I agree. Just looking at those topics, I can see how I could spend maybe a weekend. just.
Well, each webinar is 90 minutes, and there are 12 of them. So enjoy.
Excellent. And thank you for thinking of educating paraprofessionals, paraeducators, teaching assistants. In my opinion, they're one of the most important components of public education, and unfortunately, they are the most undervalued in so many ways, but not to me.
Yeah, I wholeheartedly agree. And when we have the opportunity to work with the paras, it's some of our favorite work, because they are just there for the children and want to do better by them, and sometimes just need a little bit more training to do that.
Well, thank you for sharing that, and thank you for sharing your experience and wisdom. I really appreciate it.
It's been a pleasure joining you tonight. Thanks for having me.
And folks, I hope you can join us in 1 week on June 9th for the next edition of Answers, 6 p.m. Hope to see you then. Until then, be well.